Good morning, ladies and gentlemen. Thank you for this privileged opportunity. I will introduce myself. My name is Rosa Virginia de la Recaca, just call me Virginia. At this moment, I would like to give a short speech about the effect of increasing levothyroxine dosage on a depressive mood. In general, the elderly population is very increasing and most of them experiencing the depression. Depression has become a new and crucial problem in the world of health. Depression is a mood disorder that causes a persistent feelings of sadness and loss of interest. Also called a major depressive disorder or clinical depression, it affects how you feel, think, and behave and lead to various emotional and physical problems. Research suggests that depression does not spring from simply having too much or too little of certain brain chemicals. Instead, there are many possible causes of depression, including faulty mood regulation by the brain, genetic vulnerability, stressful life events, medication, and medical problems. Depression or major depressive disorder is also a common and serious medical illness that negatively affects how you feel, think, and act. Fortunately, it is also treatable. Depression causes feelings of sadness and a loss of interest in activities you once enjoyed. It can lead to various emotional and physical problems and decrease your ability to function at work and at home. South Korea, for example, is one of the highest suicide rates among countries. However, the prevalence of depression in South Korea has been much lower than in other countries. The current study aims to estimate the prevalence of major depressive disorder using a large representative sample of the South Korean population. Approximately 10% of the adult population has a major or minor depressive disorder. 30% have clinical significant depression and 60% have depression symptoms. However, it is had to have an X time to deal with the diagnosis mentally problem and find appropriate treatment can for this mentally ill. Although medical therapy use antidepressants and psychotherapy as methods of treatment, depression is often used. It could happen like an adverse drug reaction or dose. Therefore, the potential for drug interaction and somatic comorbidities must first be considered effective. Therefore, multidimensional methods and approach and additional treatments are very important to overcome the problem of depression. Hypothyroidism is frequently associated with irritability, insomnia, anxiety, restlessness, fatigue, impairment in concentrating and memory. The symptoms can be episodic or may develop into mania, depression, and delirium in some phases. Motor inhibition and apathy are symptoms that accompany hyperthyroidism. The thyroid hormone neuroregulator during the central nervous system or CNS development plays an important role in neurocognitive function. Hypothyroidism, like depression, is widespread among older adults and its prevalence increases with age. In addition, the link between hypothyroidism and depression has been well established in society. Therefore, talking about hypothyroidism is usually treated with levothyroxine. Levothyroxine is a synthetical product from of thyroxine, the main endogenous hormone secreted by the thyroid gland and also known as L-thyroxine or Syntheroid branded product. Levothyroxine is explicitly used to treat hypothyroidism or a condition in which the thyroid gland can no longer produce sufficient amounts of the thyroid hormone T4 or thyroxine. Symptoms of hypothyroidism vary depending on how low the thyroid gland produces the hormone levels. The symptoms include easily tired and dizzy, constipation or difficulty defecating, muscles feel weak, painful and stiff, more sensitive to cold weather, dry, rough skin, easy to peel, and wrinkles. Weight gain without any cause clear, swollen face and harsh voice, hair loss and thinning, and forgetfulness and difficulty concentrating. The symptoms mentioned above develop quite slowly, even up to a matter of years. This makes the symptoms of hypothyroidism not immediately noticeable. Although it is more common in older women, anyone can suffer from hypothyroidism, including newborns or congenital hypothyroidism. The use of LT4 must be according to the dose prescribed by the doctor. The levothyroxine dosage for elderly patient and patient with heart disease starts from 12.5 mcg to 25 mcg for 1 day. The dose may be increased every 6 until 8 weeks as needed until the patient is clinically euthyroid and serum TSH returns to normal. The effects of increasing the dose of levothyroxine in hypothyroid patient is needed to meet the patient needs, namely the patient returns to euthyroid. Do not increase the dose or stop taking the drug without the doctor's permission, even though you feel well, and must be monitored by a doctor. Lastly, therefore, the effect of increasing the dose on a hypothyroid patient is very significant. In order to restore the patient's health to active euthyroid, however, the increase in the dose must be under the doctor's prescription. The doctor himself monitors the doctor's recommendation or advice, and of course the work process. That's all for me. Thank you.